Tēnā tātou katoa. Good evening. 12 leading primary care organisations have issued a grim warning. They're at risk of collapse due to staff shortages and a lack of funding. Plunkett, family planning and hospice have all been forced to cut back or close some services.
And GPs say they feel ignored by the government despite mounting evidence of clinics drowning in debt. Investigations correspondent Michael Morra has the story.
Come and have a seat.
Gisborne GP Fergus Aitchison says the state of general practice is the worst he's seen in his 16-year career.
So I'd urge whoever's got the reins come October the 15th to have a really serious look at this, because the message from general practice is pretty clear. The building is on fire.
That fire, he says, is in part due to an outdated, broken, government-controlled funding model.
If productivity falls slightly in general practice, there's a massive knock-on effect to the emergency department and the secondary sector.
It causes ramping at EDs as primary care that prevents hospitalisations diminishes.
The general practice plane is running out of fuel.
Labor's Aisha Verrill accepts GP funding is not fit for purpose and many changes are required.
I've got no confidence whatsoever. We've heard all this before and nothing's happened.
That's because the government commissioned its own review last year, which stated funding does not align with patient need, which is a serious deficiency.
We've just been given lip service and undermining from the government and gaslighting. I think general practice is we've had enough.
So you feel that GPs are being ignored?
Absolutely.
This practice in Whangarei has 11,000 patients, but like more than a third of general practices across New Zealand, it made a loss in the last financial quarter. Dr. Jeff Cunningham says that has serious implications.
Closure's a possibility, you say?
It's a real possibility. I think it's terminal unless something immediately is done for general practice funding.
There's another pressure, retaining nursing staff. Many are leaving primary care for higher paid hospital roles.
We had a going away for one of our nurses last week. She's been offered $10 an hour more at Te Wharaora than we can afford to pay her.
That nurse pay gap has seen 12 primary and community care organisations come together to demand change. Plunkett has 35 nurse vacancies.
At the vacancy rate that we've got at the moment, that potentially means that we are missing probably close to 140 visits to whānau every single day.
Family planning has also lost nurses to hospitals, which has forced service closures.
Well, we've ended up having to close clinics, so we had 64 days closed. Our clinics were closed in August, and we've also got really, really long waiting times because we have no appointments available for people.
It's the first time they have come together to call for urgent action.
We've done it because we're all facing the same issue of unable to employ or retain nurses, which means our services are being affected. We can't run services, we're reducing services.
The lure of a hospital role plays on the mind of practice nurse Michaela Barton.
That we've come into primary care or come into nursing because we want to help people and care for people. But if we are not being cared for and looked after ourselves, how can we keep providing that? We will need to go elsewhere to be able to care for ourselves.
Despite clear problems, there's no firm guarantee from Labor or National they will address pay parity for nurses or change GP funding.
It's extremely disappointing and it's dangerous.
Dangerous for tens of thousands of patients he believes could eventually be left without a family doctor.
Well, kia ora, Michael. So what exactly are National and Labor saying about these really big issues?
Yeah, well, Sam, statements from both parties, they sound good, they read good, but they are vague and they don't actually address the questions that we've asked. What we do know is that both parties support pay parity for all nurses, but that's about it. In terms of funding increases for GPs, National's Shane Rete says National will explore, quote, explore implementing the recommendations of the funding report I referred to in my story. But he didn't expressly say if he'd do it or when. Now, it's pretty dire for GPs. For example, the General Practice Owners Association told me that there have been 31 Section 14 notices issued by clinics across the country since June this year. Now, this is a formal notification of problems where clinics advise PHOs that they're actually unable to perform the services that they're contracted to do. And they do this, I'm told, when they're running out of money or they don't have staff.
Tēnā koe, Michael.